In today's session, we will discuss about environmental influences on prenatal development. The main objectives of this lesson are: what is child psychology, prenatal development, the environmental influences on prenatal development, which include teratogens, alcohol, prescription or illegal drugs, smoking, maternal stress and depression, and other teratogens. In our previous lesson, we have discussed about what child development and prenatal development is. In this session, let us go a bit further in our understanding about prenatal development and the influence of environment on the child's development. Child development that occurs from birth to adulthood was largely ignored throughout much of history. Children were often viewed simply as small versions of adults, and little attention was paid to many advances in cognitive abilities, such as language usage and physical growth that occurs during childhood and adolescence. Interest in the field of child development finally began to emerge in the early 20th century, but it tended to focus on abnormal behavior. Eventually, researchers became increasingly interested in other topics, including typical child development as well as the influences on development. An understanding of child development is essential, allowing us to understand that child development is something that begins during infancy. The prenatal period is also considered an important part of the developmental process. It is a time of remarkable change that helps set the stage for future psychological development. The brain develops over the course of prenatal period. It will continue to go through more changes during the early years of childhood. The learning theory approaches provide more important information in understanding the development of child, right from genetic influence to expression of this information through behavioral characteristics. What is prenatal development? Prenatal development is the period that extends from conception to birth. During this time, a single-celled zygote is transformed into the complex active organisms that it is the newborn. The stages of prenatal development discussed in the previous session are as follows. Fertilization. Fertilization normally takes place in the fallopian tube, where an ovum or egg cell is penetrated by a single sperm cell. The germinal period. During the germinal period, about the first 10 to 14 days after conception, the zygote migrates from the fallopian tube to the uterus and becomes a multi-celled and implants itself in the uterine wall to gain access to new source of nutrients obtained from the mother. If implantation of the zygote occurs in a location other than the uterus, an ectopic pregnancy has occurred. Such a pregnancy is potentially life-threatening to a woman. The embryonic period. The embryonic period begins after implantation and continues until about the 8th week after conception. The embryonic period is marked by development of the placenta and other supportive structures within the uterine environment and by the differentiation of cells into tissues that form the major organs and systems of the embryo. The fetal period. The fetal period, beginning in about the 8th week after conception and lasting until birth, is marked by substantial growth and by refinement of organs and systems. Neurons continue to form and migrate during the fetal period. Brain activity, sensory reactions and movements are exhibited by the fetus. Viability, that is, the ability to survive outside the womb, improves rapidly over the last 3 months of pregnancy. Gestational age differs from conceptual age by about 2 weeks because it is based on the woman's last menstrual period rather than the time at which conception occurs. The nervous system begins with the formation of a neural tube at 18 to 24 days after conception. Neurogenesis, proliferation and migration are 3 processes that characterize brain development in the prenatal period. Simply said, the basic architecture of the brain is formed in the first 2 trimesters of prenatal development. Now let us look at what the environmental influences can impact on prenatal development. The environment can have an important influence on development, and this also includes the prenatal period. The growth that happens during the 9 months of prenatal development is nothing short of astonishing. But this period is also a time of potential vulnerability. During prenatal development, environmental factors can significantly affect the development of the child. Most everything the mother ingests, including food, liquid, and even medication, travels through the placenta to the fetus. Anything the mother is exposed to in the environment affects the fetus. What is a teratogen? Teratogen is any agent or substance which can cause malformation of an embryo or birth defect on a developing fetus. Various teratogens include drugs, alcohol, tobacco, and other environmental agents. The adverse effect of a teratogen depends on several factors, such as the dose or level of exposure, heredity, age of the teratogen, and any other negative influences. Any form of prenatal stress felt by the mother can have negative effects on various aspects of fetal development. When a mother is under stress, physiological changes occur in the body that could harm the developing fetus. Fortunately, the effects of many of these hazards can be greatly lessened or even avoided entirely. While dangers do exist, the vast majority of babies are born healthy. Today, researchers understand a greater deal about teratogens, a term used to describe the broad range of conditions and substances that can increase the risk of prenatal problems and abnormalities. Teratogens can cause a wide range of problems, from low birth weight to brain damage to missing limbs. In order to minimize and avoid these dangers, it is essential to understand what poses a risk to the fetus and how such dangers can affect development. We need to understand that the prenatal developmental process that occurs during the 40 weeks prior to the birth of a child and during each prenatal stage, environmental factors affect the development of the fetus. The developing fetus is completely dependent on the mother for life, and it is important that the mother receives prenatal care, which is medical care during pregnancy that monitors the health of both the mother and the fetus. According to the National Institutes of Health, routine prenatal care can reduce the risk of complications to the mother and fetus during pregnancy. When the zygote attaches to the wall of the uterus, the placenta is formed. The placenta provides nourishment and oxygen to the fetus. Most everything the mother ingests, including food, liquid, and even medication, travels through the placenta to the fetus. Hence the common phrase that a mother eats for two. Anything the mother is exposed to in the environment affects the fetus. If the mother is exposed to something harmful, the child can show lifelong effects. Now, what could the hazards to prenatal development be? For most babies, the course of prenatal development goes smoothly. The mother's womb protects them as they develop. Despite this protection, however, the environment can affect the embryo or fetus in many well-documented ways. The general principles of a teratogen. A teratogen is any agent that can potentially cause a birth defect or negatively alter cognitive and behavioral outcomes. The field of study that investigates the causes of birth defects is called teratology. Teratogens include drugs, incompatible blood types, environmental pollutants, infectious diseases, nutritional deficiencies, maternal stress, advanced maternal and paternal age, and environmental pollutants. The dose, the genetic susceptibility, and the time of exposure to a particular teratogen influences both the severity of the damage to an embryo or fetus and the type of defect. How do we describe the dose? The dose effect is obvious. The greater the dose of an agent, such as drug, the greater the effect. Genetic susceptibility. The type or severity of abnormalities caused by a teratogen is linked to the genotype of the pregnant woman and the genotype of the embryo or fetus. Let us understand what the time of exposure means. Teratogens do more damage at some point in development than others. Damage during the germinal period may even prevent implantation. In general, the embryonic period is more vulnerable than the fetal period. Teratogens. A teratogen is any environmental substance or agent that includes biological, chemical or physical that can have a detrimental effect on developing fetus. Like we discussed earlier, exposure to teratogens during the prenatal stage can significantly raise the risk of birth defects. Several factors influence the amount of damage a teratogen can have, including dose or level of exposure, heredity, age of the teratogen, and any other negative influences. There are several known teratogens that expectant mothers are advised to avoid during pregnancy, which include alcohol, prescription and or illegal drugs, and tobacco. Alcohol and its impact. Alcohol and most drugs cross the placenta and affect the fetus. Alcohol use during pregnancy has been found to be the leading preventable cause of mental disabilities in children in the United States. Excessive maternal drinking while pregnant can cause fetal alcohol syndrome or fetal alcohol spectrum disorder, with lifelong consequences for the child ranging in severity from minor to major. It is unknown how much alcohol is necessary to cause damage, and so doctors typically recommended that alcohol should be completely avoided during pregnancy. Physically, children with fetal alcohol spectrum disorder (FASD) may have a small head size and abnormal facial features. Cognitively, these children may have poor judgment, poor impulsive control, and higher rates of ADHD and learning issues. These developmental problems and delays persist into adulthood. Based on studies conducted on animals, it also has been suggested that a mother's alcohol consumption during pregnancy may predispose her child to like alcohol. The table shows fetal alcohol syndrome facial features. This table talks about the fetal alcohol syndrome and how it impacts the facial features. The head size is below average and circumference is also below average. The eyes are smaller than average eye opening and the skin folds at the corners of eyes. The nose also has a low nasal bridge and the length is also reduced. The mid-face is smaller than the average mid-face size. The lips are the thin upper lip and there is an indistinct philtrum. The impact of psychoactive drugs on the fetus. The psychoactive drugs are drugs that act on the nervous system to alter states of consciousness, modify preconceptions, and change moods. Examples include caffeine, alcohol, and nicotine, as well as illegal drugs such as cocaine and marijuana. Caffeine people often consume caffeine by drinking coffee, tea, or Coca-Colas, or by eating chocolate. A recent research review found that high amounts of caffeine consumption by pregnant women do not increase the risk of miscarriage, congenital malformations, or growth retardation. The impact of prescription drugs or illegal drugs. Use of any type of drug, whether illegal, prescription, or over the counter, can be dangerous during pregnancy. Illegal drugs such as heroin, cocaine, and methamphetamine can cause a myriad of problems for the developing fetus. Babies can be born addicted to certain drugs and are also more likely to be born prematurely. They will have low birth weight and they experience other physical defects. Many end up with attention and behavioral problems as well. Prescription drugs taken during pregnancy such as streptomycin, tetracycline, some antidepressants, progestin, synthetic estrogen, Accutane, thalidomide, as well as over-the-counter drugs such as diet pills can also result in teratogenic outcomes for the developing fetus. Thalidomide causes bodily deformalities as well as damage to internal organs. DES exposed fetus have been shown to have higher rates of cancer and infertility as adults. Impact of cocaine. Does cocaine use during pregnancy harm the developing embryo and fetus? A recent research study found that cocaine quickly crossed the placenta to reach the fetus. The most consistent finding is that cocaine exposure during prenatal development is associated with reduced birth weight, length, and head circumference. The impact of marijuana on the fetus. An increasing number of studies find that marijuana use by pregnant women also has negative outcomes for their offspring. For example, one study found that prenatal marijuana exposure was related to lower intelligence in children. Another study indicated that prenatal exposure to marijuana was linked to marijuana use at age of 14 years. A recent study discovered that this drug, marijuana, used by pregnant women was associated with stillbirth, or simply put, giving birth to a dead baby. In totality, marijuana use is not recommended for pregnant women at all. Maternal diseases. Maternal diseases and infections can produce defects in offspring by crossing the placental barrier, or they can cause damage during birth. Rubella or German measles is one disease that can cause prenatal defects. Women who plan to have children should have a blood test before they become pregnant to determine whether they are immune to the disease. Syphilis, a sexually transmitted infection, is more damaging later in prenatal development, 4 months or more after conception. When syphilis is present at birth, problem can develop in the central nervous system and gastrointestinal tract. Most states require that pregnant women be given a blood test to detect the presence of syphilis. AIDS. AIDS is a sexually transmitted infection that is caused by the human immunodeficiency virus, or HIV. This destroys the body's immune system. A mother can infect her offspring with HIV or AIDS in 3 ways: across the placenta during gestation, through contact with maternal blood or fluids during delivery, and through breastfeeding. The transmission of AIDS through breastfeeding is a particular problem in many developing countries. Babies born to HIV infected mothers can be 1. Infected and symptomatic, that is, they show HIV symptoms; 2. Infected but asymptomatic, that is, they do not show HIV symptoms; or 3. Not infected at all. An infant who is infected and asymptomatic may still develop HIV symptoms up to 15 months of age. Maternal diet and nutrition. A developing embryo or fetus depends completely on its mother for nutrition, which comes from the mother's blood. The nutritional status of the embryo or fetus is determined by the mother's total caloric intake as well as her intake of proteins, vitamins, and minerals. Children born to malnourished mothers are more likely malformed than other children. Being overweight before and during pregnancy can also put the embryo or fetus at risk, and an increasing number of pregnant women in the United States are overweight. Maternal obesity adversely affects pregnancy outcomes through elevated rates of hypertension, diabetes, respiratory complications, and infections in the mother. Maternal age. When possible harmful effects on the fetus and infant are considered, 2 maternal age groups are of special interest: adolescents and women who are 35 years and older. The mortality rate of infants born to adolescent mothers is double that of infants born to mothers in their 20s. Adequate prenatal care decreases the probability that a child born to an adolescent girl will have physical problems. Paternal factors. So far, we have discussed how characteristics of the mother, such as a drug use, disease, diet, nutrition, age, and emotional states can influence prenatal development and the development of the child. Might there also be some paternal risk factors? Indeed, there are several. Men's exposure to lead, radiation, certain pesticides, and petrochemicals may cause abnormalities in sperm that lead to miscarriage or diseases such as childhood cancer. The father smoking during the mother's pregnancy can also cause problems for the offspring. In one study, heavy paternal smoking was associated with the risk of early miscarriage. This negative outcome may be related to maternal exposure to second-hand smoke, stress and depression in the mother. Any form of prenatal stress felt by the mother can have negative effects on various aspects of fetal development and can cause harm to both mother and the child. When a mother is under stress, physiological changes occur in the body that could harm the developing fetus. Additionally, a stressed mother is more likely to engage in behaviors that could negatively affect the fetus, such as smoking, drug use, and alcohol abuse. Prenatal depression is often caused by the stress and worry that pregnancy can bring, only at a more severe level. Other factors that can put a person at risk for prenatal depression include unplanned pregnancy, difficulty becoming pregnant, history of abuse, and economic or family problems. Impact of smoking on the fetus. Smoking tobacco is also considered as a teratogen because nicotine travels through the placenta to the fetus. When the mother smokes, the developing baby experiences a reduction in blood oxygen levels. According to the Centers for Disease and Control Prevention, smoking while pregnant can result in premature birth, low birth weight infants, stillbirth, and sudden infant death syndrome (SIDS). The sudden and unexplained death of a child less than 1 year of age. Other issues that can be caused by prenatal exposure to smoking are inattentiveness, muscle tension, and colic, a form of pain which starts and stops abruptly and occurs due to muscular contractions in the body. The more a mother smokes or is exposed to second-hand smoke, the greater the risk. However, quitting, even after smoking during pregnancy, greatly reduces the risks of these problems. Let us also study about other teratogens and environmental hazards. Many aspects of our modern industrial world can endanger the embryo or fetus. Some specific hazards to the embryo or fetus include radiation, toxic wastes, and other chemical pollutants. Women and their physicians should weigh the risk of an X-ray when the woman is or might be pregnant. However, a routine diagnostic X-ray of a body area other than the abdomen, with the woman's abdomen protected by a lead apron, is generally considered safe. Other teratogens that affect prenatal development include pollution and infectious diseases. Pollution such as exposure to mercury or PCBs can cause physical deformities, abnormal speech, and difficulty with coordination. Maternal infections such as viruses or parasites can also cause brain damage to the fetus or even death. The major prenatal diagnostic tests are summarized in the table shown. Many parents can utilize these tests to diagnose the fetus in case of abnormalities to identify their future course of action. Understanding importance of prenatal care from a support group point of view. Although prenatal care varies enormously from one woman to another, it usually involves a defined schedule of visits for medical care, which typically includes screening for manageable conditions and treatable diseases that can affect the baby or the mother. In addition to medical care, prenatal programs often include comprehensive educational, social, and nutritional services. Information about pregnancy, labor, delivery, and caring for the newborn can be especially valuable for first-time mothers. Prenatal care is also very important for women in poverty and immigrant women because it links them with other social services. An innovative program that is rapidly expanding in the United States is Centering Pregnancy. Now, let us sum up the lesson. The course of prenatal development. Prenatal development is divided into 3 periods. The germinal, that is from conception until 10 to 14 days later, which ends when a zygote, a fertilized egg, attaches to the uterine wall. Embryonic, 2 to 8 weeks after conception, during which the embryo differentiates into 3 layers. Life support systems develop and organ systems begin to form, or organogenesis. And fetal, lasting from 2 months after conception until about 9 months or when the infant is born. a time when organ systems have matured to the point at which life can be sustained outside the womb. By the time babies are born, they have approximately 100 billion neurons or nerve cells. The nervous system begins with formation of a neural tube at 18 to 24 days after conception. Neurogenesis, proliferation and migration are the three processes that characterize brain development in the prenatal period. The basic architecture of the brain is formed in the first 2 trimesters of prenatal development. The prenatal diagnostic tests such as amniocentesis, ultrasound, sonography, fetal MRI, chronic villus sampling and maternal blood screening are used to determine whether a fetus is developing normally. Under the heading of hazards to prenatal development, we have discussed that a teratogen is any agent that can potentially cause a birth defect or negatively alter cognitive and behavioral outcomes. The dose, the time of exposure and genetic susceptibility also influence the severity of the damage to an unborn child and the type of defect that occurs. Prescription drugs that can be harmful include antibiotics, some depressants and certain hormones. Non-prescription drugs that can be harmful include diet pills and aspirin. The psychoactive drugs, which include caffeine, alcohol, nicotine, cocaine and marijuana, are also potentially harmful to the offspring. Cigarette smoking by pregnant women also has serious adverse effects on prenatal and child development, which includes low birth weight. Problems may also result if a pregnant woman has rubella or German measles, syphilis, genital herpes or AIDS. A developing fetus depends entirely on its mother for nutrition and it may be harmed if the mother is malnourished, is overweight or has a diet deficient in folic acid. High levels of anxiety and stress in the mother are also linked with less than optimal prenatal and birth outcomes. The maternal age can also negatively affect the offspring's development if the mother is an adolescent or if she is 35 years or older. Radiation is also a potential environmental hazard. Factors such as improper prenatal care also impact the development of the fetus.